The youth is the hope of the nation. We often say this phrase for the younger generation to be inspired or motivated in their progress of being a good leader in the community. But according to the CPD, or the Commission on Population and Development, at the end of year 2020, they have noticed that 70,755 families were led by minors. They project that this number will increase up to 133,265 families by the end of 2021. Today, I will share about teenage pregnancy, the risks, and why it is rampant in today's generation. So first, let us talk about teenage pregnancy. Teenage pregnancy, or also known as adolescent pregnancy, is a pregnancy that occurs in a female under the age of 20 years old. Pregnancy can occur with sexual intercourse after the ovulation, which can be before the first menstrual period but usually occurs after the onset of periods. In case you are wondering what are the positive sides of teenage pregnancy, well, to tell you frankly, being a young dependent parent doesn't have any positive outcomes as it just enhances the poverty of our country. Besides, being or having teenage pregnancy is very risky because being pregnant in such an early age is so much risky as the mother may have urinary tract infections. The mother could have STD complications. The mother could have anxiety due to premature death, and it can have a preterm birth. And lastly, the mother could experience depression, which is very deadly to the young generations today. And as the child may reduce birth weight, and the child is higher risk of death. The child will have a growth of restriction, and the child will have an infection. For the social impacts of teenage pregnancy is social isolation, lack of qualifications, and could not complete education, and not living independently. Because being a teenage parent is very hard since you are dependent to your parents also. Since you as a teenager don't have work and have money to sustain the needs of the child. Therefore, you need to ask a guidance and or help to your parents. So, why is teenage pregnancy rampant in today's generation? First is early sexual debut. This is the most misconception of teenagers nowadays, that they have normalized having sex with opposite gender or sex, and that is not good. Second, lack of access to comprehensive sex information and education. Lack of education about sex. Third, parents who identified by adolescents as one of their preferred sources on sexually reproductive health information, or have limited communication skills to their parents. Fourth, lack of access to family planning services. Fifth, cultural practices of early union. Sixth, and last, the lack of adolescent sexuality and reproductive health policies and its full implementation. So that's all for today. I hope you have learned or gained something about teenage pregnancy, and I will say it again, that we, the youth, is the hope of the nation. Therefore, we should act and we should do the right thing in a for us to enable to have a better society and a better community in the near future. Thank you.